Welcome back to the Hydrogen Studies podcast. In today's episode, we're talking about heart attacks. We'll explore the global impact of myocardial infarction, the challenges of ischemia reperfusion injury, and how hydrogen might fit into the puzzle, not as a miracle cure, but as a potential new tool in the cardiovascular toolkit. Let's get into it. This is the Hydrogen Studies podcast, sponsored by Echo Water. To understand why hydrogen matters to heart health, we first need to understand what happens during a heart attack. When the blood supply to part of the heart is cut off, usually by a clot in a coronary artery, oxygen can't reach the heart muscle, and this condition is called ischemia. The longer the heart is starved of oxygen, the more damage is done. That's why every second counts during a heart attack. But here's the twist. Restoring blood flow, while absolutely necessary, comes with its own risks, and this is known as reperfusion injury. When oxygen-rich blood suddenly returns to the tissue, it can lead to a burst of free radicals, highly reactive molecules that damage cells. And this oxidative stress can cause inflammation, cell death, and worsen the injury to the heart. This paradox, where the very act of saving tissue also risks harming it, is a big reason why researchers are looking for ways to protect the heart during and after reperfusion. Let's zoom out for a moment and look at the broader picture. Heart attacks, or myocardial infarctions, are not rare events. According to a 2023 systematic review and meta-analysis by Solari and colleagues, the global prevalence is higher than many of us might expect. They analyzed data from 32 studies representing 34 million individuals and found that the global prevalence of myocardial infarction is 3.8% among adults under 60 and 9.5% among adults aged 60 and older, nearly 1 in 10. This means millions of people around the world are walking around with a history of heart damage, often carrying not just the physical scars, but emotional and neurological ones as well. The bottom line is clear. Heart attacks are not isolated events. They are a global health burden. And here's why that matters. The impact of a myocardial infarction doesn't stop once the immediate danger has passed. Survivors face a heightened risk of subsequent cardiac events, long-term heart failure, and in the case of cardiac arrest, significant neurological injury. The post-heart attack period can involve months or even years of rehabilitation, medication, anxiety, and lifestyle change. For many, it's not just a single moment of crisis, but the beginning of a new reality. So even a small improvement in how we treat or protect the heart during and after a myocardial infarction could ripple outward, affecting survival rates, quality of life, and healthcare costs on a global scale. This is what makes the exploration of therapies like hydrogen so intriguing. We're not talking about replacing existing treatments. We're talking about the potential to add something small, something safe and targeted that might help protect heart tissue, limit damage, or improve outcomes in those critical early hours. That brings us to hydrogen therapy. Over the past decade, researchers have been exploring whether molecular hydrogen, yes, the simplest molecule in the universe, might hold surprising potential in the treatment of heart injuries. Not as a silver bullet, but as a targeted way to reduce damage caused by oxidative stress and inflammation. And some of the most compelling early evidence comes from preclinical animal models. Let's start with a 2022 study by Gong and colleagues. In this experiment, researchers simulated cardiac arrest caused by asphyxia in rats. This is a particularly severe type of arrest, where oxygen is cut off and the heart eventually stops beating. After resuscitating the animals using standard CPR techniques, they introduced hydrogen gas therapy. Specifically, the rats inhaled 2% hydrogen for 2 hours. So why hydrogen? The key lies in how cells respond after the heart starts beating again. When blood flow is restored, the body is hit with a surge of reactive oxygen species, or ROS molecules, that can cause serious cellular damage. The heart is especially vulnerable in this moment. One of the cellular processes triggered is autophagy, a kind of self-cleaning mechanism where the cell breaks down damaged parts. Under normal conditions, autophagy helps maintain healthy cells. But during intense stress like reperfusion after cardiac arrest, autophagy can become overactive, essentially causing the cell to cannibalize itself. Gong's study found that hydrogen gas therapy inhibited this excessive autophagy. Compared to the untreated group, the hydrogen-treated rats had significantly less heart damage, improved cardiac function, and reduced expression of autophagy-related proteins like Beclin-1 and LC3-2. In simple terms, hydrogen helped the heart heal better, likely by calming this runaway self-destruct system. Now, this is promising, but it gets even more interesting when you look at how hydrogen stacks up against existing treatments. That's where the 2012 study by Hayashida and colleagues comes in. In their experiment, rats were resuscitated after electric shock-induced cardiac arrest and then randomly assigned to one of the three treatments: normal air, therapeutic hypothermia, or hydrogen gas inhalation. Hypothermia, cooling the body to reduce damage, is a well-established therapy in post-cardiac arrest care. It's one of the few interventions shown to improve neurological outcomes. The surprising result: hydrogen therapy performed just as well as hypothermia. Rats treated with hydrogen showed better neurological scores, lower mortality, and less oxidative stress in the brain. Just like in Gong's study, the hydrogen seemed to target the damage caused not by the arrest itself, but by the storm of oxidative molecules that followed. Even more intriguing, hydrogen plus hypothermia did not provide significantly more benefit than either treatment alone, suggesting they may share overlapping protective pathways, most likely related to reducing ROS. Rats are not humans, and cardiac arrest in a lab isn't the same as cardiac arrest in a chaotic emergency room. But these studies give us a strong starting point. They show us that hydrogen can safely reduce heart and brain injury in a tightly controlled setting, and they help pinpoint some of the mechanisms that might make that possible, namely reduction of oxidative stress, modulation of autophagy, and preservation of mitochondrial function. In other words, hydrogen isn't doing everything. It's doing something very specific and potentially very valuable during this delicate window after blood flow is restored. So while we're not ready to put hydrogen canisters in ambulances just yet, these studies suggest it's worth asking the next big question: what about humans? But first, a word from our sponsor. Your body is a system, and when it's running right, you feel focused, energized, in flow. But sometimes we struggle to find that flow state. Why? Because there's too much static in our system: brain fog, fatigue, and inflammation. The Echo Flask clears the static by infusing your water with molecular hydrogen, a natural, science-backed gas that helps your body think sharper, recover faster, and run smoother. This is more than hydration. It's better focus, more energy, faster recovery, less internal stress, and long-term benefits that keep you sharp. When your water works harder, your whole system does too. Find your flow state with the Echo Flask hydrogen water bottle and get an unlimited supply of hydrogen water at home and on the go. Visit echowater.com and use code H2Studies to get 10% off of your first order with Echo Hydrogen Water products. Let's look at what's actually happening inside the heart when it undergoes and recovers from a heart attack. During a myocardial infarction or heart attack, the heart muscle is starved of oxygen. This initiates a cascade of cellular distress signals and energy failure. Cells begin to malfunction, mitochondria, the energy producers, start to lose integrity, and waste products build up fast. Now here's the kicker. When blood flow is restored through medical intervention, that life-saving reoxygenation paradoxically causes a burst of reactive oxygen species, or ROS. These are highly reactive molecules, especially hydroxyl radicals and peroxynitrite, that can shred through membranes, proteins, and DNA like molecular wrecking balls. This is called reperfusion injury, and it's one of the main reasons heart tissue continues to die even after oxygen is restored. So where does hydrogen come in? In their 2025 study, Pan and colleagues explored this exact question. They found that molecular hydrogen significantly reduced the size of myocardial infarction in rats, and the mechanism wasn't just general antioxidant activity. It was deeply tied to mitochondrial protection. More specifically, hydrogen blocked apoptosis, or programmed cell death, by interrupting the ROS-mediated mitochondrial pathway. That's the pathway that gets triggered when ROS levels spike and signal the cell to initiate self-destruction. Hydrogen therapy helped preserve mitochondrial membrane potential, stabilize mitochondrial function, and decrease the expression of pro-apoptotic proteins like Bax and cleaved caspase-3. In plain terms, hydrogen kept the heart cell's powerhouses alive and functional during a time they'd normally shut down. Importantly, hydrogen doesn't behave like typical antioxidants that sweep away all ROS indiscriminately. Studies show that hydrogen targets only the most dangerous radicals like hydroxyl and peroxynitrite, while sparing the ROS needed for normal cellular signaling. That's what makes it so unique. It's not a blunt force antioxidant. It's precise, selective, and tuned to the body's needs. It's this precision that allows hydrogen to mitigate damage without disrupting the signaling systems cells use to adapt and recover. That includes preserving mitochondrial dynamics, balancing autophagy, and supporting anti-apoptotic defenses. So while hydrogen isn't stopping a heart attack, what it may be doing is quietly reducing the collateral damage, helping cells survive the chaos that follows. So what about humans? In 2016, Tamura and colleagues conducted a groundbreaking pilot study on 5 patients who had just survived cardiac arrest. After doctors restored their heartbeat, what's called return of spontaneous circulation, these patients inhaled hydrogen gas for 18 hours. The results were remarkable. 4 out of 5 survived for at least 90 days, and all 4 had strong neurological outcomes. No complications, no adverse side effects. Just survival, paired with preserved brain function. That study was small, but it wasn't a one-off. In 2020, Tamura's team followed up with a second investigation. This time, they looked at what was happening inside the patients, and what they found? Hydrogen gas inhalation reduced key oxidative stress biomarkers in the blood. In plain terms, hydrogen didn't just appear safe, it looked like it was actively reducing the cellular chaos that follows a cardiac arrest. And that safety profile, it holds up across dozens of human studies. Hydrogen gas is well tolerated, even at high concentrations, and shows promise in a wide range of conditions, from stroke and Parkinson's to metabolic syndrome. In fact, Japan has already taken action. 2% hydrogen gas inhalation is approved there for emergency clinical use in post-cardiac arrest care. And it's not just about safety. Researchers are seeing that hydrogen may cross the blood-brain barrier, support mitochondrial function, and regulate inflammatory responses, all critical after brain trauma like cardiac arrest. To be clear, these are still early-stage results. Large randomized trials are needed, but what we've seen so far isn't just encouraging, it's disruptive. Hydrogen therapy might not just survive scrutiny. It could redefine recovery after one of the most devastating medical emergencies there is. So where does all of this leave us? Hydrogen therapy for heart attacks is not a miracle solution, but it's a scientifically grounded, low-risk intervention that might reduce damage when it matters most, during the critical hours after cardiac arrest or myocardial infarction. As researchers continue to explore its applications, hydrogen therapy could become part of a multi-pronged approach, used alongside hypothermia, oxygen medications, and advanced life support. It also opens up broader questions. Could hydrogen be useful for preventing long-term damage in a stroke? What about during heart surgery or organ transplants, where ischemia reperfusion injury also occurs? And can it be safely scaled for emergency settings like ambulances or field hospitals? Those are the questions science is just beginning to answer. Well, that's it for today's episode. Hydrogen therapy and heart attacks, an area filled with both promise and caution. If you're enjoying this series, make sure to follow the show, share it with someone curious, and stay tuned for the next episode. Until then, stay healthy, stay curious, and we'll catch you next time.